Good morning. I think ISMSIS session is advised by Dr. Amulya Sahu, who is the founder chairman, Dr. Jagannath Boramani, who is the chairman, or vice chairman, Dr. Parikshit Gopte, and all the team has taken tremendous efforts to design this program. And ISMSIS is working for SICS promotion in India as well as abroad. The topic allotted to me is SICS scenario in India and abroad. In India, people talk about FECO, they knew about ECC, but they also know about SICS. So SICS promotion comparatively was easy in India. But in foreign countries like America, Australia, what we have observed, they are being taught ECC in their residence days and directly FECO. So if some complication occurs in FECO, they do not know how to convert. So SICS is not known to them. And that is the worst thing because it is not ticked in their curriculum. So it is the job of ISMSIS body to promote SICS abroad. And we have started various chapters in various countries across the world. This particular scenario in abroad, you should remember, there was COVID. In COVID, immature cataracts got matured, hyper-matured, black, brown, and whatnot. Now the surgeons, they know about FECO, and in FECO, they know how to tackle the soft cataract. But they didn't have any training to tackle black and brown cataract. Now the problem was what to do. One of the Indian surgeons who was there in Australia started doing SICS. And there was so much of crowd gathered in her OT, and there was a big scene. What is this different technique? How the whole nucleus can come out and how the vision is regained after the surgery. So this was new to them. This is a fact what I am telling you. So mature cataracts handling is difficult in foreign countries because they do not have any experience to tackle the mature cataract. Recently I have seen one patient from America who had PLPR. The person was well educated, but because of that insurance technique and waiting period in America, he was not getting controlled diabetes, and so surgery was not done. He came to India and the surgery was done. Such sort of hypermature patients even are not seen in India, but it was seen in America because of that particular circle of their reference. So extracapillary to FECO, that is the thing in abroad, whereas SICS must be the in-between step, which is there in India. So complicated cases and hypermature cases tackling is very difficult. In India, always compared with FECO, that is one of the options. It is the art of hand, that is manual surgery, like handwriting. We are forgetting handwriting because we are typing on mobile and computer. Then spelling, we don't need to remember, it is auto-spelled. Drawing, you are forgetting, it is done on computers. So, non-machine dependent, that is the thing which you are going to carry with SICS. So, one of my friends, Dr. Rajiv Raut, is charging 2 lakhs. That's what he has said, you can quote me. He is saying cost of the lens is 5,000, but my charges, surgical charges are 1,95,000. And he operates SICS. He says, I don't know FECO. This is my technique. If you want to come, and there is a waiting list. So this is the way you should learn. You should charge your own skills, your technique. It is the art and not the machine. You shouldn't correlate your charges with your FECO machine and your IOL. So it goes to masses, easily available in India. And no inferiority complex is the mission of ISMSIS. So better understanding of wound reconstruction to eliminate astigmatism has been done by even SICS surgeons. Myopic astigmatism is little there in SICS, but it is better for near vision, remember. Minimally invasive, even 2 mm is done by Dr. Amulya Sahu nowadays. Astigmatism is well corrected by Dr. Boramani's technique. Bifocality is done by smart SICS, Dr. Rajiv Raut's technique. So this is also minimally invasive. So better nucleus delivery techniques are available. Technique to give bifocality, that is smart SICS by Dr. Rajiv Raut. So India is exporting this technology to all third world countries. So better acceptance of SICS by thinking ophthalmologists of developed countries. It was resistance for America and Australia to form ISMSIS chapter there because they were afraid. Insurance companies, government rules and regulations, university, it is not written in our syllabus how to do, why to do. But we have promoted. And now they are saying, we will send our ophthalmologists to India, train them in a proper way, give them training. We will ask our patients to get that surgery done. Basically, they should include it that particular surgery in their insurance, their government's rules and regulations. So acceptance will be there. Like poor countries in Africa, they have accepted in a nice way. Only the problem was about developed countries. So thinking ophthalmologists in all type of countries, including developed countries, is being done. So what next to SICS? We shouldn't wait here. What we should do? That is promoting SICS and quality cataract surgery everywhere. It must come in scientific journals. It should get very well promoted there, because documentation is very important. National and international masters must be there, like simulators are there. But teaching, there are faculty going everywhere in the world. Dr. Parishit Gopte has been doing wonderful job in that particular aspect. So wet labs and hands-on training is done. At AIOCMTC conferences recently, which was held at Chandigarh, we had that simulator training. And it is being accepted everywhere. We have got various centers where the training is being given. There are medical colleges, and at medical colleges, suppose the phacosurgeon is there and SICS surgeon is not there, he may not promote. So catch them young. Teach your PGs and residents about this SICS surgery. At district hospitals, taluka hospitals, primary health centers, wherever the cataract surgery is done, this SICS technique is perfect and useful in India. You must promote that. You should teach your juniors and even seniors should promote that surgery in a nice way. So contribution of India, that is Indian subcontinent, that is India, Nepal, Bangladesh and Pakistan, to the world of ophthalmology. Not just economical and easy, but classy, and has ability to deliver effective outcomes unaided 6-9 and N6. I think I am not exceeding my time. So manual SICS, it will remain, of course, not only remain, it will not vanish at all, but it will flourish. Remember that. And with these words, this is my humble appeal and request all of you to vote and